Hello, I am Dr. Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Center, Navi Peth, Pune. Let us talk about why test tube baby fails in patients who have recurrent pregnancy losses or multiple miscarriages and multiple times curating done. Now, test tube baby is done to patients who cannot naturally conceive. There are certain patients who have naturally conceived previously in the past, but unfortunately they miscarry in the first trimester, as a result of which many a times they are subjected to curettage, which is called as D&E or D&C in colloquial terms. And these are the category of patients when they are posted for test tube baby show a persistently thin endometrium with very poor vascularity, very poor blood supply and very poor endometrial thickness. Now these patients, when we take up for IVF, ideally we do not take up the patient immediately for IVF. Whenever there is a history of more than 2 miscarriages or more than 2 curetages in the past, it's a good idea to do a zero cycle in which we get to know whether the endometrium is growing or not, because many a times we get very high quality embryos, but if your endometrium is lagging behind or very poor vascularity, in spite of advances like PRP or something, it will not compensate the basic vascularity, and hence these patients have more tend to fail in test tube baby technology. So whenever a patient of multiple pregnancy losses comes to an IVF consultant, please be very frank about your history of previous treatment which you have taken or previous curetages, so that we will be able to analyze you accordingly, and only if you have a good endometrium in the base cycle, then only we form embryos and we transfer them later for the best possible success rate in these patients of previous curetages. Thank you.